Hello, everyone. It's Tuesday, December the 7th. It's Pearl Harbor Day. It's also our grandson, Kathy and I's grandson's birthday, and really a day that will live with all of us on the attack on Pearl Harbor. But nevertheless, we've had an additional 76 deaths in West Virginia since the last time we were here, and it's unfortunate as it can be. We need to continue to try to talk it up and help each other to realize without any question that we need to get vaccinated. The more that are vaccinated, the less will die, until absolutely there's a point in time when the great scientists or medical minds of the world come through with something that'll shut this thing down. But to think it's not with us is a bad move. And to think you don't need your booster shot is way even a worse move. And so for those of you that are 50 and older, I don't know how to make it any plainer than just this. If you've been fully vaccinated and you're walking around thinking I'm fully vaccinated and you're 6 months out from your Pfizer or Moderna last vaccination, you're not covered. You're not vaccinated. And without any question, in 2 months out from J&J, you're not vaccinated. And if you're 50 and older, absolutely you're in real danger. You got to get that booster shot. That's all there is to it. You just have to get it, and you got to get it now. The 4,946th death, an 88-year-old female from Pendleton County. The 4,947th death, a 31-year-old female from Marshall County. The 4,948th death, a 59-year-old male from Lincoln County. The 4,949th death, a 92-year-old female from Marshall County. The 4,950th death, a 63-year-old female from Lewis County. The 4,951st death, a 70-year-old female from Kanawha County. The 4,952nd death, an 83-year-old male from Ohio County. The 4,953rd death, a 65-year-old male from Morgan County. The 4,954th death, a 45-year-old male from Morgan County. The 4,955th death, a 73-year-old male from Kanawha County. The 4,956th death, a 77-year-old female from Harrison County. The 4,957th death, a 69-year-old female from Marshall County. The 4,958th death, a 59-year-old male from Berkeley County. The 4,959th death, a 72-year-old male from Hardy County. The 4,960th death, an 86-year-old male from Jackson County. Now get this. The 4,961st death is a 22-year-old female from Hardy County. It's terrible. The 4,962nd death is a 54-year-old female from Preston County. The 4,963rd death, a 92-year-old female from Calhoun County. The 4,964th death, a 46-year-old male from Mingo County. The 4,965th death, an 81-year-old female from Grant County. The 4,966th death, a 68-year-old female from Wirt County. The 4,967th death, a 67-year-old female from Nicholas County. The 4,968th death is an 89-year-old female from Monongahela County. The 4,969th death, an 82-year-old male from Mineral County. The 4,970th death, a 67-year-old female from Hardy County. The 4,971st death, a 77-year-old female from Marion County. The 4,972nd death, a 75-year-old male from Marion County. The 4,973rd death, a 64-year-old male from Mineral County. The 4,974th death, a 70-year-old male from Wetzel County. The 4,975th death, a 75-year-old female from Kanawha County. The 4,976th death, a 77-year-old female from Putnam County. The 4,977th death, an 84-year-old male from Hancock County. The 4,978th death, a 78-year-old male from Wood County. The 4,979th death, a 90-year-old female from Marion County. The 4,980th death, a 66-year-old male from Brooke County. The 4,981st death, an 83-year-old male from Grant County. The 4,982nd death, a 71-year-old male from Summers County. The 4,983rd death, a 69-year-old male from Wetzel County. The 4,984th death, a 61-year-old male from Hampshire County. The 4,985th death, a 48-year-old male from Mingo County. The 4,986th death, an 87-year-old male from Mercer County. The 4,987th death, a 76-year-old male from Fayette County. The 4,988th death, a 72-year-old male from Marshall County. The 4,989th death, a 57-year-old male from Braxton County. The 4,990th death, a 56-year-old female from Kanawha County. The 4,991st death, a 62-year-old female from Lincoln County. The 4,992nd death, a 64-year-old male from Hampshire County. The 4,993rd death, a 58-year-old female from Cabell County. The 4,994th death, a 68-year-old male from Berkeley County. The 4,995th death, a 64-year-old female from Putnam County. The 4,996th death, an 87-year-old female from Jefferson County. The 4,997th death is a 46-year-old male from Taylor County. The 4,998th death, a 44-year-old male from Hardy County. The 4,999th death, a 21-year-old male from Lewis County. Good gracious. The 5,000th death in West Virginia, a 56-year-old female from Randolph County. The 5,001st death, a 75-year-old male from Roane County. The 5,002nd death, a 62-year-old male from Mercer County. The 5,003rd death, a 74-year-old male from Marshall County. The 5,004th death, a 67-year-old female from Greenbrier County. The 5,005th death, a 74-year-old male from Clay County. The 5,006th death, a 55-year-old male from Taylor County. The 5,007th death, a 93-year-old male from Calhoun County. The 5,008th death, a 71-year-old female from Kanawha County. The 5,009th death, a 79-year-old female from Fayette County. The 5,010th death, a 70-year-old female from Kanawha County. The 5,011th death, a 48-year-old male from Kanawha County. The 5,012th death, a 74-year-old male from Wetzel County. The 5,013th death, a 56-year-old female from Marion County. The 5,014th death, a 61-year-old male from Marion County. The 5,015th death, a 73-year-old male from Wyoming County. The 5,016th death, a 84-year-old female from Fayette County. The 5,017th death, a 69-year-old female from Roane County. The 5,018th death, an 86-year-old male from Mingo County. The 5,019th death, a 61-year-old male from Wood County. The 5,020th death, a 73-year-old male from Braxton County. And the 5,021st death in West Virginia is a 75-year-old female from Grant County. Please, if you know them, contact these people. Let them know they're not alone. Let them know these people were not just a number. And absolutely, if you don't, offer up your prayers. Please do. Active cases in West Virginia now are 8,249. There's 771 new positive cases in the last 24 hours, 11.12 positivity rate. The cumulative rate is now at 6.28. There's 288,000 that have recovered. There's 585 in the hospitals. You're back above 200 in the ICU units at 201. 103 are on ventilators. The thing that's going up right here is the number of people that are in the hospital that are vaccinated has decreased a little bit. Now, really, there's 82% of the patients on that are in the ICU units or on ventilators are not vaccinated. And there's 78% of the people that are in the hospitals now are not vaccinated. We have 1 green county, 25 red counties. There are currently 15 school outbreaks in 14 counties and 349 cases confirmed. Let me just say just this. Stay with me just 1 second. There's over 8,000 active cases now in West Virginia. We dropped down in probably the 5,000 range, and now we're above 8,000, 8,249 cases. Without any question, there is 585 people that are in the hospital in West Virginia, and that's slightly up also. You have an uptick from the standpoint of in the ICU units, and you have an uptick from the standpoint of the people that are in the hospitals that are not vaccinated. You've got 25 red counties in West Virginia. Let me just ask one simple question. How in the world, if you're over 50 years of age, how in the world, if you're over 18 years of age, but especially if you're over 50 of age, how in the world, if you are fully vaccinated with your first and second shot of Moderna or Pfizer, or your first shot of J&J, how in the world can you not run to get your booster? Do you really believe, with all the scientists, everybody in the world is saying what they're saying, do you really believe that because you've got the first and the second shots, you're protected? Everybody is telling you that getting the first and second shot, good, yay. But absolutely everybody is telling you that if you're 6 months out from that first and second shot, Pfizer and Moderna, and 2 months out from the J&J shot, you have virtually no protection right now. And everybody's telling you how infectious these variants are, or these, the Delta variant, or the other variant is right with us. And I think it's Omicron, but nevertheless, everybody's telling you how infectious they are versus the regular COVID stuff. You're not protected right now, West Virginia. You're not protected. I don't know of anything that could be more foolish than not going to get your booster shot. 65 and older, if you have any symptom, call us. The antibodies will save your life. You ought to really think if you're 65 and older, if you're wearing, to wear a mask if you go into a crowd of people you don't know especially, or if you're compromised with your health issues in any way. We're still doing the Do It for Baby Dog Round 3, and that was targeted at our younger people and everything. And there's all kinds of good stuff happening. We're going, I think, on Friday to the Eastern Panhandle, but we just go all over the state, and we continue to encourage and ask people over and over and over, especially kids, to think with their parents and everything. They've got to have parental consent, but without any question, they ought to be thinking about getting vaccinated. I just was in a meeting just a second ago with folks from up in the Wheeling area, and one of the guys said, without any question, his daughter that falls right in this age group right here, without any question, she went and she got right across the finish line by watching Baby Dog. Well, of all things, I'm telling you, that program has been really, really successful. No matter what anybody tries to say or throw mud, that program has really worked, and we've been very, very, very happy and very fortunate to be able to do that program, to have the dollars to be able to do it. We're branching out because we've got so many of our senior citizens that are not taking the booster shots. So we're branching out to another program. We're going to call it Do It for Baby Dog Senior Center Edition. And this program is open to all of our 200 senior centers all across our state in association with the county aging providers. Now, all seniors who get their first and second and booster shot will automatically receive a $50 prepaid Visa gift card. all seniors that receive the first and second and booster shot, or just J&J booster shot, all the seniors will receive a $50 prepaid Visa gift card as an additional incentive, especially at this time of year. I'm sure those dollars can come in handy. And the top senior center in each of our state's 4 county aging provider regions, based on the vaccination rate, will win $100,000 for that center. And also, in addition to that, we'll bring Baby Dog there to see everybody as well. But just please help us get this going. And General Hoyer will be on. You know, he's not with us today. He'll be back on Thursday. He's the man that came up with this idea, and really and truly, we take any and all ideas to get us really just more and more exposure from the standpoint of getting more and more people across the finish line. We thank all those that have come up with different ideas and everything. You know, this is not just me sitting here coming up with ideas, or my people right around me coming up with ideas. This is absolutely, you know, the brainchild of General Hoyer and his people, and we will be hosting clinics all across our state, you know, to National Guard centers and on and on. So yeah, let me jump to something else here. You know, the booster shots. You know, the FDA came out in the beginning, and the CDC was lagging a little bit and everything. It said, you know, well, first we came out and said, if you're 18 and above, go get your booster shot. You can qualify in one of these categories to get your booster shot. And then the FDA came out and said, no, we now agree, 18 and older, everybody get their booster shot. And then the CDC followed. So really and truly, I can't see where you've got any excuse if you're 50 and older to not get that booster shot. If you've lost your card and everything, just contact us at DHHR, and we'll get you a replacement on that. From a standpoint of those kids or those people 18 and above in West Virginia, we have a vaccination rate at 69.6% of those people have received their first dose. 81.9% of the over 50s have received first dose, and 89.7% of over 65 first dose. So we got to continue in every way to, you know, especially with the 50 and olders. Look at this number. Those that are fully vaccinated, 50 and older, are 71.3%. Now, I said 82% have had their first shot. 71.3 are fully vaccinated. You got to get your booster shot. Do you know how many people of that group? Now, let's just think about this. Let's just stay right with this just 1 second. Come back to me just 1 second, Jordan. Now, just think about this. 82%, 50 and older, have had their first shot. 71%, 50 and older, have had both shots. How many do you think of that group that are tremendously exposed? Of that group, how many have gotten their booster shot? 26%. 26%. 26% of the 50 and olders in our state. 82 of them said, I want the first shot, and they got it. 71% of them have got their second shot. 26% of them. 26% of them have gotten their booster shot. Now let me tell you, and I'm just telling you just as point blank as I know how to tell you. If you're 50 and older, and you're eligible for your booster shot and you don't have it, you're not protected. You're not protected at all. Are you willing to take that chance? Are you willing to look at your family, look at all your friends and everything, and just think for just a second that you are not protected at all? Absolutely. If you're 50 and older, you best better run to the fire today, because you're not protected. if you are absolutely eligible at this point in time for your booster shot, meaning you're 6 months out or 2 months out, you know, if in fact you're eligible for that booster shot, you're not protected. 26% of you have taken that shot. Now listen, I'm super respectful of everybody, and I'm super respectful of everybody's rights. There's no question about that at all. But I am telling you, without any question, period, if you have been fully vaccinated and you do not get this booster shot, that is just plain not smart. You got to do it, and you better do it quickly. Eligibility is 5 and above. All the COVID information's up there on our hotline. The Grand Families Incentive Program is winding down. It's over on December the 15th. That's for the $150 voucher, school voucher. The Rental Assistance Program, you're wasting time there, and that's going to get away from us and everything. Your landlord or renter, you better contact us. There may be dollars available for you. All the free testings out there, we thank Frith and Walgreens over and over. There's 46 outbreaks in our long-term care facilities. Get this is wonderful, wonderful, wonderful news. There is no outbreaks in our church community right now. That's what we want to hear. There is no outbreaks in our church community. Way to go, people. That's good stuff. 30 inmate cases and 32 staff cases. That's way down. Way to go, corrections. That's good stuff. Get your flu shots. You can do it at the same time as you get the COVID vaccine or your booster or whatever. Absolutely, you should be doing that. Now, here's something that we should all know, and we should all give honor. We lost an incredible man in Senator Bob Dole, a man that is a true, true, true American hero. 98 years old. His service to this country is just unparalleled. All the great stuff that this man has done is just off the chart. We lost him at the age of 98, and our flags will fly at half staff until sunset on Thursday, December the 9th. You know, so many great Americans we've lost, but this is one special man right here. So I ask you to honor the life and the service of this great man. Just an announcement, our state holidays, I'm issuing a proclamation declaring that Christmas Eve on Friday, December 24th, and New Year's Eve, Friday, December 31st, as they will be full day state holidays for public employees. And I'm also declaring that Thursday, December 23rd, and Thursday, December the 30th, it will go a half day. There'll be a half-day state holiday on those 2 days. You know, the VOCA grants, we've received, an additional $3,999,933, and this will be for the victims of crime, the victims of Crime Act assistance grants is what they are. They are funds to 84 public and private nonprofit agencies throughout our state. I have been an advocate of this funding with our legislature over and over because every single dollar of this goes to help someone, and it goes to help someone in need. The funds will also support assistance to victims as they move through the criminal justice system. There is so much good that comes in this, and it is terrible. It is terrible that we have to deal with this, but properly funding this is absolutely what we should do. And so with all of that, I couldn't be more proud and more happy and more pleased that we got these additional dollars, and it's 84 public and private or nonprofit agencies we've added to the list. And so we'll just continue to try to help, and that's more and more goodness. Our hunting and fishing license giveaway, we've done this in, a couple years in a row, and, it has been tremendously successful in getting the number of licensees that we have up, and You know, this is our third annual hunting and fishing license giveaway that is official, that today, or now it's officially open. Anyone, I'm gonna read this for you, anyone who purchases an annual 2022 hunting, trapping, or fishing license in the month of December will automatically be entered in order to be able to win all kinds of different prizes and everything. But anyone who purchases their 2022 hunting, trapping, or fishing license will automatically be entered. We want to encourage everybody to get out there and right now and purchase that gift and everything, and for yourself or others. And I go through this all the time, and I'll just say just real quick. I have spent my life in the outdoors. I love to hunt. I love to fish. I'm not a trapper, but I love to hunt and fish. And in doing so, I spent so much time in the outdoors. Absolutely. So many incredible memories. So many wonderful, wonderful, wonderful days. Relationships with your dad or your mom, your brothers, your sisters. So many, many great times. You know, this state abounds in beauty beyond belief. Please, please, please. Try to take time, and I'm going to even try to do it before we're done here. I've got a picture on my phone. I'm going to try to put it up here and everything where you can see it and everything that I took spring turkey hunting this past year, and see if I can get that up. I don't know if we can get it up or not, but we'll try. You know, but and it'll just show you the beauty of this unbelievable state and what you're missing if you don't take advantage of just doing this. Get yourself outdoors some way, somehow, and just see what I've been able to see all my life. In a joyful night, the First Lady and I are encouraging all West Virginians to watch the annual Joyful Night celebration this Thursday, December the 9th at 7 p.m. You know, we'll be lighting the tree, doing all the stuff and everything. It's so much good stuff and everything. You'll see the Cabell Middle and Marching Band. You'll see musical performances by Baileysville K through 8 school. It's just on and on and on. Parkersburg South will be there. It's just great, 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 great celebration. You know, so, you know, the Mountaineer Challenge Academy is participating. It's just so many different things that you really need to see this. So stay tuned and watch it, please. The last thing I have is when I get done here, I'm going to Harrison County. In Harrison County, we're doing an announcement today with Game Changers. Now get this, Game Changers today at 2 o'clock is going in Harrison County. The Game Changers is joining with the Hazelton Betty Ford Foundation, and with us in 3 schools in our state right now. We started out in the 3 schools to empower students to some way resist this opioid and substance abuse, possibilities throughout their life. This program is going to be the first. I mean, I always love in West Virginia when you're saying the first of its kind, and results from it will be absolutely nationwide before long. This program is really the real deal, to be able to help with with this terrible situation that we have with addiction in our state, and so many tragic results. So today we're going to be launching a new program, and it's a student-powered program and everything, and so stay tuned, and I'm sure you'll get a lot of the details. But Game Changers doing great work and everything, and so many programs throughout our state that continue to help us. Like I said over and over, and I don't say this because of the First Lady, I don't know how we could ever have a program better than Communities in Schools. We'll take help in every direction, and we're very, very, very positive about Game Changers moving us forward as well. So thank you so much. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. To reinforce a few things that the governor has said, as we look around the country, we can see that states that are becoming colder, like Minnesota and Michigan and Wisconsin, are starting to have a substantial increase in the spread of COVID-19. And this is still the Delta variant, but it's causing a real upswing in the level of illness in these states, the number of cases, and that's resulting in an increase in hospitalizations. And as we've talked about many times during these briefs and other interviews, we all are focused at saving lives, number one, and trying to maintain our hospital capacity, number two. When it comes to saving lives, and we look at West Virginia related to COVID-19, we rank currently 14th in the country with the highest number of deaths per 100,000 people. And over the last week, we find ourselves the third most deaths per 100,000 people in the country. And these deaths are occurring largely in people who are not vaccinated or who have not actively gone to get their booster. As the governor said, our real foundational strategy is to make sure that as many people who are over 50 years old in West Virginia, please choose to get your primary vaccination series. And when you're eligible, please choose to get boosted. We know that the residual protection from many studies that are coming out from around the world show that the mRNA vaccines, Pfizer and Moderna, but particularly Pfizer, loses some of its ability to reduce infection at about 2 months, but still retains its ability to protect people from hospitalizations over 4 months, and then over the 4 to 6 month period start to drop a little bit and then continue to drop. So boosters are really important, and Moderna has a little bit more continued potency, but also tends to drop after 4 and 6 months. So really important, as we see that about a quarter of our hospitalizations are in people that have been vaccinated in the past, and 11.1% of our deaths since we've had the vaccines are in people who have been previously vaccinated. We know that boosters are so important to try to prevent that. And because our hospitals continue to be relatively full, we have not been able to get back down to that very low number of hospitalized people that we saw after our December 2020, January 2021 peak, where we got down to 52 people in hospital beds in West Virginia from COVID-19 in early July. But now we still have 585 people in hospital beds today, which means that we are much fuller. And we also know that staffing is much less available to us than it was in the past. So our hospitals could get into very challenging waters if we all don't do our part. So one part is that we want to get all of our over 50-year-old West Virginians, which account for over 95% of our deaths, those ages, to be fully vaccinated and to get boosted. And right now, our booster rates are in the 43% range or so, if you count all the people that have been previously vaccinated and the number of people that have been boosted. But we also really need to start to choose to have our children vaccinated at much higher rates. When we look at the transmission of COVID-19, particularly the Delta variant, and now looking forward to the Omicron variant, we know that children can transmit COVID-19 now just as well as adults. And in West Virginia, over a quarter of our cases are seen in children 0 to 18. So really important to choose vaccination for this population, not only because we want to avoid severe consequences, long COVID symptoms, but also we need to start to reduce transmission in West Virginia. And we've seen our case rate about double. And we know that the Omicron variant is coming. In South Africa in the month of November, they saw Omicron account for 74% of their genetic sequencing of new COVID cases, which is really an absolutely astounding change from the impact of Delta before. And it's shown in research from South Africa that Omicron is about 3 times more able to infect people that have previously been infected with COVID-19 than the Delta variant, which is highly, highly transmissible. When we look at the US, we still see the vast majority of cases genetically sequenced are from the Delta variant, not the Omicron variant. And the problems going on in Michigan, Minnesota, Wisconsin are the Delta variant. currently in West Virginia. We just got our most recent genetic run back again. We have no cases that we've sequenced so far of the Omicron variant. We are 100% Delta variant right now, but we know the Delta variant is still highly capable of infecting people who are not vaccinated, who don't have current active immunity with the boosters. And we know that the Delta variant continues to make people sick here in West Virginia, and it's starting to lead to more cases. It's starting to lead to more hospitalizations. And so we are very, very concerned about what's upcoming in the next month to 2 months. So really important that everybody who listens, please get your vaccine series and your booster if you're eligible. Please be careful when you're in indoor environments coming up, because we know that people not only are exposed to COVID, but also to the flu, which we also are concerned will cause more problems with health of West Virginians. So please get your flu shot as well. Last thing is that we follow the RT values, the reproductive scores, and we've seen those continue to go up. We're at 1.09 today, which is higher than it's been since the peak of the last surge. So we have all signs saying that COVID is spreading again in West Virginia. The winter and cold months are upcoming. The likelihood for more spread is upcoming. Our hospitals are already still half full with COVID from our peak of 1,012. We're at 585 people in hospital beds today. So really important for all of us to take those right precautions so that we keep ourselves healthy and we keep our hospitals from being overwhelmed with people who are infected with COVID-19, so that we can continue to give all the good care to everybody in West Virginia who needs it. Thank you.
Thank you, Dr. Marsh. We'll now go to Dr. Ayn Amjad, our State Health Officer.
Good morning. I just wanted to remind everyone, and Clay mentioned as well, about the flu vaccines. We do see a decrease in the amount of people going out for the flu vaccines. And so we want to remind everyone to do that as well. Also, testing has increased. We've seen a lot of people going back for testing, especially after the holidays. So if you are feeling sick or not sure, definitely go and get tested. And we definitely want people to go out and get their boosters. That's all I had, Jordan. Thank you.
Thank you, Doctor. Retired Major General Jim Hoyer and Secretary Bill Crouch had prior engagements and will rejoin us on Thursday. We'll now go to questions from members of the media. The first today from Charles Young with West Virginia News.
Charles, I saw that and everything, and without any question, it's a nationwide problem, is it not? And but Charles, there's I think really and truly, if we could get Scott Atkins to come on, maybe Scott could talk a whole lot more in detail about this than I can talk, and I do believe that Scott's done a great job, but this is a nationwide problem, with anything. I'll never forget, as bizarre as it may sound, but I was at a national corn growers conference. I was just a young kid. I was probably at the time, 28 or 30 years old, and the guy that was the head of the Department of Agriculture, they were just coming out with a new farm bill and everything, and he said, I wonder how many people, even though it is a very, very small percentage, I wonder how many people are going to try to take advantage and scam the system. And so with all that being said, you got that at play, and when it's rushed out as frantic as this was rushed out and everything, Scott's done a heck of a job, but I'd like to have him on where he could answer that question more in detail.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Is that me?
That's you.
Hello?
Talk.
Okay.
Talk.
If I'm up, let me ask the governor. I'm having some technical problems here. If there's what his concerns are about the RISE program within the Department of Commerce being under federal investigation, as it was revealed on Monday at the interim hearing concerning flood relief.
Well, Mark, again, a lot of those details, are surely going to come out in time and everything. I cannot imagine that there's been mishandling and at the commerce level, and I can positively guarantee you there's no mishandling from the standpoint of with my people that are around me or myself. So I think we just let it play out, and let's just see the outcomes and everything. And if someone has been doing something in error and everything, then I think they should be held 100% accountable.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Governor, last week you said that you had been exposed at a school appearance to the coronavirus, and I wanted to know how you proceeded from there. I know you got tested, and I'm taking by the fact that you're with us today that everything has turned out okay. But did you do any self-isolation after you were notified that you had been exposed? And if something had gone awry and you had tested positive, do you have a plan in place on how it proceeds from here with you as the chief executive of the state? And, do you divvy up some responsibility? Do you turn it over to somebody? Thank you.
Well, Paul, you're answering, in-depth questions. I mean, without any question, that if I were to have, COVID and everything, that we would deal with it on the severity. I mean, if we had a situation that was genuinely really severe, then we'd look at handing over duties and responsibilities and everything. If we looked at a completely mild case, we surely wouldn't have a need to do that. I'm completely vaccinated. I have my booster shot, and without any question, I'm going to continue on living my life, and I'm going to continue on, going places and being with people and everything. I'm going to try to be safe if I can be, and there's times when I wear a mask and everything. If I'm going into a situation to where, I know that there's people around me that are, the possibility of them being unvaccinated and exposed. And so, we take every precaution, and the good Lord has blessed Kathy and I that neither one of us have gotten COVID in any way. And so we're going to continue to be fully vaccinated, and we're going to continue to live our lives. And so I guess, Paul, the bottom line is, I've said it 1,000 times. There's no playbook here, is there? There's no real playbook with this at all. And if there's need to pivot and change, we'll pivot and change with the need.
All right, thank you, Paul. Governor, we were able to get Scott Adkins, the Executive Director of Workforce West Virginia, on today. So I want to go back to Charles Young. Charles, if you want to ask your question again, Scott is willing to take the question. Looks like we may be having issues with Charles there. Scott, do you want to just give a quick overview?
Yeah, I can. As most folks saw from the Legislative Auditor's Report, West Virginia, through Workforce, distributed about $83 million in what we consider fraudulent funds. We've worked very hard with our federal partners, law enforcement, with local state prosecutors, also with USDOL and the Office of Inspector General. And I can tell you that the majority of the fraud that occurred in West Virginia had little impact on the Unemployment Compensation Trust Fund. 98% of the funds that were lost were CARES Act funding, and it really came about because of the requirements for pandemic unemployment assistance. Most of the folks know now that under the CARES Act, independent contractors, gig workers, self-employed folks could self-attest that they had wages in 2020, and we were required by federal law to make payment. And so that's where the majority of the fraud occurred in the first 6 or 8 weeks of the pandemic. I can assure you that we've taken every step possible, both from a technological perspective, but also from a procedure and process perspective, to ensure that no tax dollar, whether it's state dollars or federal dollars, is sent to any bad actor.
All right, thank you, Scott. We have one question remaining today. We'll go to June Leffler with West Virginia Public Broadcasting.
Hello, Governor, Justice, and panel. I would like to direct my question to Dr. Clay Marsh. I wanted to talk more about the trajectory of the Delta virus. So before it really took hold in West Virginia, we saw how it played out in India, other countries, and in the southern states in the US. And, you know, it had a very sharp increase, but kind of with the same velocity it fell. And for us, we're not seeing that. It kind of fell halfway and now we're back up again. And I was just hoping that you could tell us, you know, why is that the case? You know, why is it not the same trajectory that we saw in the southern states? Why are we seeing increases here in West Virginia and in the Midwest, like you mentioned? You did say that, you know, weather plays into it, but, you know, are there other factors? You know, did the Delta variant just not meet its full potential in our state when it peaked? Just any more details on that would be appreciated.
Dr. Marsh, please go.
Thank you, Governor, and thank you, Jim. You know, I think, Jim, that this really does reflect the issues that we've talked about a lot, which is the loss of potency of our immune response related to time from either, last vaccination or infection. And we know that the Delta variant is a particularly strong variant for respiratory transmission from person to person spread. And we know that the immune system from a native infection is relatively strong very early, although different in different people, but also seems to wane. And that's really true of what's been found with the Omicron variant now in South Africa. We know that people who have been fully vaccinated and boosted, who have active immune response, tend to have a much better time in reducing severity of illness as far as being hospitalized or being in the ICU or on a ventilator or dying. We know that 89% of the people who have died, even since the vaccines have been available in West Virginia, have been unvaccinated. And we see over and over that unvaccinated West Virginians and Americans really are bearing the brunt of both the COVID-19 infection, and we know that you're 16 times as likely to get infected with COVID-19 and hospitalized if you're under 50 years old, if you're 50 to 64 and unvaccinated, 35 times more likely to get COVID-19 and be hospitalized, and over 65, 15 times more likely to get COVID-19 and be hospitalized. So the chances are much higher. And I think that the steep up and the steep down that we saw in countries like India were really a reflection of acute infection of a very large part of their population. Remember, their seroprevalence rate, their antibody positive rate, went from in the low 20s to over 80% and 1.4 billion people that live in India. So there was an acute sort of global infection of their population. And very early, then that gave the surviving parts of their population the immune function to be able to see that sharp up and sharp down. Although, as we've said, officially 400,000 people died in 10 to 12 weeks when Delta impacted India, and maybe as many per two teams from Harvard and Brown University, maybe as many as 3.5 million to 5 million people died in India. But I think now what you're seeing is there's a loss of potency of that response. Any native immunity that was gained back in the summer when we had our last spike or early or fall is probably waned now. And so what you're seeing is you're seeing reinfection rates in people who did not become vaccinated go up because the potency of the immune response has gone down, and people that haven't been boosted or immunized in the past, we see those people getting infected too. So I think that accounts for the sharp up and down in the initial times that Delta impacted, say, India, but now this sort of consistent stopping, this plateauing, which is still very much puts us at risk because, as we talked about, our hospital beds versus our peak, which was 1,012, now are over half full with people with COVID. And that's not to mention all the other people that have other medical reasons to be in our hospitals. So I hope that helped.
All right, thank you, June. We were able to reconnect with Charles. So Charles, if you'd like to ask your question again, Scott is still on.
Hi, Commissioner Atkins. Yeah, I also wanted to get your response to the report and its finding about 83 million in fraudulent payments. You know, from your assessment on your side of things, how do you think this happened? Do you think the findings are accurate? Thank you.
Yeah, that's a great question. I do think the findings are accurate. As I mentioned earlier, with the implementation of the CARES Act, a new segment of our population were permitted to apply for unemployment compensation benefits. Again, those are those independent contractors, self-employed, gig workers, Uber drivers. And unfortunately, we don't have data or wage records on those folks. And so under the CARES Act, folks could self-attest that they had wages in any given period, and we were required, without being able to vet those wages, to provide unemployment compensation benefits. For example, folks would show up with handwritten receipts that they purchased at Walmart or Walgreens or somewhere like that. And we were required by federal law to make those payments. Thankfully, USDOL, the Office of Inspector General, got together, figured out that that was not the appropriate way to manage those resources, and allowed states then to start to vet those claims. Just to put this in perspective, if you look at some of our surrounding states, it's projected Ohio lost nearly $500 million. If you go to the West Coast, you're looking upwards of $40 billion in California. Now, what the Office of Inspector General has determined is that typically about 10 to 12% of all the benefits paid from CARES Act are paid to bad actors. And so once we were able to vet those claims, the majority of the fraud stopped. Again, I mentioned earlier, it's no consolation if you lose $1, whether it's state tax dollars or federal tax dollars. But I can assure the employers of West Virginia, it had very little to no impact on the unemployment compensation trust fund. And so really, it's the 83 million is unacceptable. But I think when the federal government put into the CARES Act, they accepted that there was going to be liability just like this. And so, but we worked really hard. We put in a lot of different technological tools that help us detect fraud. We're currently working with the National Association of State Workforce Agencies. They have an integrity hub where all the claims from every state gets dumped into. And so we're able to run claims filed in West Virginia with claims filed in other states. We also are cross-matching with the Department of Corrections every week. So to make sure that we don't have folks who are incarcerated file for unemployment benefits. We're also working with the Department of Motor Vehicles to cross-reference folks for identification verification.
All right, thank you, Charles, and thank you, Scott. Governor, I'll turn it back to you.
Well, I really don't have anything else. I would hope that with all due respect, we'd remember all those at Pearl Harbor. We would absolutely remember Senator Bob Dole and all of his family and loved ones and everything. And the last thing before I go, you know, I mentioned just a second ago about all the goodness of the outdoors and the beauty of this incredible state. You know, I want to show you a picture that I took, you know, at sunrise. I was spring turkey hunting, and that was in Monroe County, and that's at sunrise. You know, I'm telling you, without any question, if you have the opportunity to get outside and enjoy nature and get in this incredible state, you'll see things like this. They'll touch your soul. They'll absolutely touch your soul. And so with all that, the only last thing I would say is please get your booster shots, really and truly. You're really making a bad mistake not moving forward with that, and you're really, really, really making a foolish mistake putting it off. Get your booster shot. Thank you all so much.